WBZ this morning is taking a look at the matters of the mind in our ongoing series. Mental illness not only costs patients their quality of life, but it turns out mental illness also costs society big time when treatment isn't available.
The burden of taking care of mentally ill can fall on the criminal justice system, and Bree is here with some numbers that may surprise you. Hi, Bree.
Good morning, Chris and Catherine. We want to be clear here. The overwhelming majority of people with mental illness will never be involved in a crime. However, in a crisis, the National Alliance on Mental Illness says people are more likely to encounter police than to get medical help. Some 2 million people with mental illness are taken to jail every year, mostly for minor crimes.
Guilty of murder in the first degree.
We, the jury, found the defendant Eddie Ray Ralph guilty.
Joe Harsonayev sentenced to death.
Edwin Alamany is guilty.
The headlines are difficult to ignore. Extreme cases of violence, often among people with previously recognized mental illness. But these faces are far from the full picture of mental health and criminal justice.
We need some better options for the mental health community to be able to intervene appropriately when needed.
John Larrabee of the Boston-based Criminal Resources for Justice says 40% of the people served in their halfway houses have a mental health problem.
With mental illness, it's a steep challenge to us, a very difficult challenge. First of all, we're not equipped with specialized treatment services in the program, and we don't find the availability of those services in the community, in particular for a population that is criminally involved.
Larrabee says insufficient treatment options lead to more people being in jail.
I'm not a mental health expert, so I don't have the answer for the mental health folks to do. I just know that it's not working on this side.
Guilty.
Looking behind the headlines, WBZ security analyst Ed Davis points to the closing of mental health hospitals decades ago, leaving emergency rooms and police to pick up the slack. Consider this from the Centers on Sentencing and Corrections. Mental illness affects men and women in jail at rates 4 to 6 times higher than in the general population. From 1983 to 2013, violent crime across the country dropped 49%, yet annual admissions to jail nearly doubled from 6 million to 11.7 million people.
The amount of money that's being spent on it is extremely large, but there doesn't seem to be a good coordination of resources. We need a plan. We need to be conscious of what's happening and how to better spend the resources that are pouring out of public coffers day in and day out.
The Massachusetts Department of Mental Health will tell you that people with mental illness are actually far more likely to be victims of crime than to commit a crime themselves. However, the data is clear that something has to be done to get people who are ill treatment early and in places more appropriate than, say, jail. And certainly addiction and the war on drugs has been a big component of that.
Treatment is key, and it's just
early intervention.
Exactly.
Yeah, absolutely.
So this week we've been continuing this great series, and now I know we've exposed a lot of different things here, but you're looking at some solutions down the road?
That's the point tomorrow. So we want to, we're talking about early intervention and prevention. The next couple days we're going to talk about some groundbreaking research here in Boston that is amazing, that you'll definitely want to hear about, as well as the politics that go into this. You know, there's a lot of funding issues. You got to follow the money, right? So we'll do just that.
All right.
All right.